Hello, I'm Wendy Dickinson and I'm a trustee of the Charity Action for Pulmonary Fibrosis. And I'm here today with Carmine Ruggiero to talk about lung function tests, breathing tests. Carmine, tell us something about yourself.
Very brief. I'm an interstitial lung disease specialist nurse. I work at Oxford University Hospitals. I've been an ILD specialist nurse for about 5 years now, and the majority of my work is on an outpatient basis with individuals living with pulmonary fibrosis.
Now, I said we were talking about breathing tests. Now, the posh name is it spirometry, and particularly we want to talk about home spirometry, where people can do these tests that normally they go to the hospital for at home, which I think is fascinating. Can you explain a little more about that?
Yeah, I think spirometry is really interesting. It's not a new test, but it's one that's traditionally been done in a hospital or possibly a GP environment. And it's one where an individual will take as big a breath as they can and blow that out as hard and as fast as they can. And measuring those things will give clinicians a whole host of information around about how someone's lungs are, how clear their airways are, for example, or whether there is a lot of potentially restricting, so stiffening of the lungs, potentially with lung scarring.
So it's a really crucial thing.
It's enormously so, and for individuals with pulmonary fibrosis, it's often the mainstay of looking at how stable disease is and treatment response, and a lot of that will be very reliant on regular spirometry. Historically, that would require someone to come in maybe 2, 3, 4 times a year, depending on how they were, and they would come into a hospital environment, and then they would do the test here, and then the results would go to their clinician. What's possible now is to actually do that test with similar accuracy in terms of instrument within their own homes. And those results can then be sent and be seen by the clinician, often in real time.
That's really interesting because, I mean, I'm not a medic, but what I understand is that, you know, this is a very unpredictable disease and it's progressive. Therefore, if you're only going in to do a lung function test every 3 months, say, into hospital, there could have been a lot of change. So presumably that's going to help if someone is doing this test on a more regular basis at home.
Absolutely. I think often people will, at initial diagnosis, they will talk about the fact that it isn't a disease that will progress in a very predictable fashion, that will go in fits and starts, and there will be potentially periods of very rapid decline. And to catch that and to intervene early in that, to catch that very early is crucially important. And if you're only measuring lungs, you're only doing spirometry 3, 4 times a year, then really you're getting you're looking at someone's lungs in any detail every 3 months. And as you can say, a great deal can change in that time. And even if someone were to call a helpline, and most of the specialist centres will have one, physically getting a lung function appointment and bringing someone in for that test can take some time. So far better, in theory, to be able to do that test at home.
Now, that's the really strong pro for home spirometry. We need to look at the realities and obviously later in this interview we're going to bring in a couple of patients to get their point of view, which will be really useful. But the thing that strikes me when I hear patients talk about lung function tests, they kind of dread them and they think, oh, it's, you know, I will have deteriorated. They actually dread the test. It's quite stressful. So as a layperson, I'm thinking, you go to a hospital, you've got the support of a healthcare professional to do your test, and now we're asking you to do it at home on your tot. So how does that work? Is that difficult?
I think it is an ask, and I would never dream to pretend to someone who's never, for example, done a spirometry test that it's a trivial thing to do, or just blow into this device, it'll all be fine. We're asking people to blow with effort, to force that breath out. And that can, for some, make them feel profoundly breathless afterwards. It can trigger cough. So it's never a trivial thing that we're asking of people. And I'm almost inordinately grateful when someone hands me their spirometry result, because I appreciate the effort that's gone into that. And I agree, where there's a lot of value is in having somebody there with you, a physiologist that's there that will coach you through that process. And then there is an inherent security around being in a hospital environment when you're doing this. I think there are ways to kind of replicate some of that within the home. So what we would ideally, you're looking to replicate the pluses, but actually remove the need to come into hospital. And often specialist centres are ones where we're in, a county or two away. So to come in just for that test, blow really hard and then go home, is something that, it's a real ask for it, that we're asking of people. Potentially, when you're asking people to do it maybe monthly or 1 to 3 monthly, then they can plan their day a little bit around that. They don't have the travel time. Often family or friends, depending on how friendly they are, can do the shouting almost and asking them to keep going and going and going, and to really get that, every ounce of air out, because that is the crucial part. Sending in the test is one thing, but having the technique associated with that, so the test is robust, I think is really important. And often people find that having somebody with them for the reassurance, but also that little bit of coaching, is quite helpful.
Yes, no, that sounds really, really, really positive. Of course, the one thing I didn't ask you is, I've done my test. Mm-hmm. Where are the results? Are they in the ether? How do I get them to you?
A lot of modern spirometers will interface onto an app. So you will never, there's nothing on the spirometer itself. It's basically a handheld device with a blown tube. I have one here. I'm not sure how well it comes out, but you can kind of see there's nothing really there other than a mouthpiece and a handle.
You just put that slightly higher, and that's it. That looks very simple.
It is, and all this will do will be to lock on to either a smartphone or to an iPhone, and there will be an app, and all that information about the breath and how that breath has changed as the person has forced that breath out is all captured on that app, and it's stored on whatever device they've used. And then the usual way that we would get results is that someone then chooses to to export that information, both the numbers and those that are very familiar with lung function will remember that there's often like graphs and traces, and all of that is then emailed across. And for example, we have a dedicated email address for that, and then a clinician will then look at them. And in our case, we will look to feed back, give brief feedback to say, well, actually, this is what we thought of the trace in terms of how good it was, how robust a trace it was. This is how it fits in with your previous results. Is it the same as what you did a month ago? Better, slightly worse? And when we would like you to do it again. And that's a clinical decision, rather than simply saying, oh, forevermore, do these once a month.
Yeah, no, I understand that. So we've got this very small device sending a signal to an app on the smartphone that I've downloaded, and then I choose as a patient whether or not to email that. So why would you not want all the tests? What is the value in the patient choosing?
Oh, I think within the app, it's retaining control. That it's not a device that behind your back almost is sending kind of clinical information out into the ether. So I think for us, the fact that you retain control. Some individuals, I must say, we will ask it for a period of, say, we will on clinical need, say about a month. Others will, some people will go, well, actually, I like doing it on a Sunday. I'll do them on a Sunday, and then I'll send in those results monthly.
Now, this all sounds great. You've explained it really well. I think I understand it. I know I understand it. But I suppose for me, the only important question, in a way, is if more people did home spirometry, would it improve their care?
I think where all of us certainly within the NHS are looking to deliver services closer to home, and in a centre that receives referrals in from multiple counties, that for me as a nurse is writ large. For those where someone started on antifibrotics, I used to live in a world where they would drive several counties to have a conversation with me about how they felt on a particular drug, and I felt enormously guilty about that. I think the world's moved on, and where conversations like we're having can occur in real time now. To support that, to have more than just a conversation, to actually say, I can talk to my clinician from my own home, and there is these kind of robust measures that are meaningful, that can help that consultation, I think is hugely important. And I think it's not simply about more timely data or accurate data, but actually to be able for those living with chronic lung conditions to be able to do more of that without huge disruption to their lives, I think is fundamentally important, and where I think the NHS should be moving. And certainly our trust, and I think all trusts, have a lot of work going on about delivering care closer to home and also delivering digital technologies. Also, it means that there are more ways from us within a clinical centre to engage with people. So it's not simply once every 3 months, or it's not simply when they pick up the phone, because often you'll get a lot of other things. They'll send in the spirometry result and a bit about how they're feeling, or often people will have like one of the finger probes, a SATS probe, and they'll tell me how those sorts of things are. And so it breaks down that you can only ever speak to a clinician once every 6 months, and then and the only other time will be if you're hugely worried in a deteriorating scenario, for example. I think it normalizes that actually that kind of light touch engagement can happen much more frequently.
So here we are, I'm happy to say, joined by Colin and Sue, who both have pulmonary fibrosis. Hello to both of you.
Hi.
Thanks so much for taking part in this video. We hope it will help people who are contemplating doing lung function tests themselves at home. Now, Carmine has explained the technicalities of it, and from the medic's point of view, why they like you to do it. But I really am interested in your own personal experiences. If I could start with you, Sue, first.
Yeah.
Do you feel confident doing this test at home?
Yes, I've done probably about 7 or 8 now, monthly, and yes, I don't need to look at my instruction notes now as to how to do it, unless I am having a mental forgetfulness moment.
One of those days.
I find it quite easy to use, quite informative, and the results go. And within a day or 2, if not perhaps the same day, I get a little bit of info back saying thank you for submitting your results, etc., etc.
That's very good. I mean, obviously, when you do the test at the hospital, because it can be quite difficult, can't it, to take that deep breath and then to breathe in the right way. Yes. You've got a healthcare professional there, shall I say encouraging, but often shouting at you.
Yes.
Do you have anyone at home, or do you just shout at yourself?
I have my husband at home, but he's not much use. So no, I'm usually concentrating. I've got my eyes closed, puffing out as much as I can. So the little balls that indicate on your phone as to how you're doing, I don't watch them. So I've usually got my eyes closed and in deep concentration, trying to get this air forced out of my lungs.
Well, it sounds
for as long as possible.
Sounds as though you're doing a good job.
It's quite appreciated.
Really?
Watch.
Colin, how do you find it? You confident doing this at home?
Yeah, no, yes, I'm quite confident. In fact, I can say virtually exactly the same as Sue. You do it, work your way through it, send off your results, and again, same day or shortly afterwards, you'll get a note from somebody saying that, or giving you an indication of what your results are, what they show, which is, it's okay, it's good.
It's very good.
I mean, Carmine, this last one, Carmine said there were indications of light breaths to start with, extra breaths to start with, before actually doing the test. But I thought, well, I didn't do that knowingly. But if you do pick up a spirometer and bring it to your mouth before you blow from a distance, what you're doing is you're pushing air through the turbine, and the turbine will spin. It's very delicate. So when you bring it up to your mouth, just before you blow, you've actually put air through it, which is showing up. And that's why I reckon I got those early tests. So there's lots of little things that you can sort of fine tune, I think.
Yeah, so you just need a bit of practice and a bit of experience, really.
Yeah.
The main thing I thought, Sue, is do you think it's had an impact on the kind of care that you're receiving?
Yes, I do. I mean, I'm quite new to this disease, illness sort of thing. It's only in the last 12 months that it's come to light, and it's early stages. But it saves a lot of travelling back and forth to a hospital to have different lung function tests. So yeah, I do find it it's quite encouraging. And if I am having a particularly, whether it's weather related or I'm a bit phlegmy and I feel a bit breathless, I can do it and see, looking at the previous results without submitting. Say if I've just done a test, I can look at and see if there is a bit of a problem, and then I'll perhaps get in touch with them to say, I've done a home spirometry, I'm not feeling too great, my chest is a bit phlegmy, or I'm struggling with breathlessness. And, you know, you say you get a reply back within, certainly the same day, you know, and then a positive answer with how to go ahead and do stuff, you know, to put you back on track. So it does save time of going into hospitals, which in these present conditions is a bonus.
That's very good. And also, normally you'd go into hospital every few months, wouldn't you? I mean, this way it kind of keeps you in touch with the medics who are treating you. And didn't you tell me, Sue, when we were chatting about this, that they actually changed some medication as a result of receiving some
Yes,
tests?
back in February, I had, it wasn't a chest infection, I was just getting breathless. I was on my oxygen 3 litres a minute, but just getting breathless, say getting up out of bed, trying to get dressed, moving around the house, just pottering about, which is what I normally do. And getting out of breath, talking. And so I sent an email, I think, to Carmine, and he said, could I do a home spirometry test to send in, which I did. And the result of that was they lowered my steroids, but then they upped the steroids to try to clear the chest, and arranged a CT scan. And I think that was on a Thursday or a Friday. And then on the Saturday, I had the CT scan for the Banbury. Mm-hmm. So it was all very quick.
That's brilliant, isn't it?
And all from my kitchen, if you like, you know, without having to travel.
Absolutely. I mean, that's a really good thing.
So, so having this and having your oximeter as well is, they're all little things just there to help you. I mean, you know your body, you know what it feels like. If there are slight changes, I mean, the weather affects me, then you've got the equipment there that you can test yourself. And say, if you have a problem, there's always somebody at the end of the phone or at the end of an email, you know, which is brilliant.
That's great. Colin, how do you feel about how accurate these tests are? Because that was one of my big questions. You know, you're in hospital, you've got a healthcare professional there helping you to do the tests, you've got all the gear that they've got, and then suddenly, as Sue said, you're in your own kitchen or whatever with this little thing. Do you think it's accurate?
I think it's accurate too. If I look at my results, I mean, I make a spreadsheet, so I've got spreadsheets of all my results, hospital results as well. Hospital results, they do differ, but not by a great deal. And my results, as a monitor, as a maintaining, there's no big drops, no big rise, nothing. So it's reasonably level. So I consider it to be accurate to, if each time I do it comes up with a similar result, then I consider it to be accurate. If it fell, I would do the same as, if it was a drastic difference, I'd do the same as Sue. Get on the phone to somebody to find out. But yes, I think they're accurate. They monitor, which is the good thing. You can monitor your breath.
No, I mean that is good to hear. The other thing I thought that you could actually, sorry Sue, go on.
I was going to say, if you use the same equipment, it's a bit like, as you say, weighing yourself. If you weigh yourself on the same set of scales, you're going to get the same measurements, aren't you? But if you went on this and went on something different, then it would possibly give a slightly different reading. But if you do 3 barometer tests, which is what they want you to send in, then they take the average of the 3 readings.
Yeah, no, you're absolutely right. And I think also listening to you two, it shows to me that you're actually really involved in your own treatment in a way. You know, you're not just sitting at home waiting to go in 3 months' time to see a medic. Does that mean a lot to you?
Yeah, that's absolutely right. Yeah, I mean, my home spirometry tests are 4 weekly. So when I've sent a thing in and had a reply back from Colin, then he'll put a date on it when the next one is. So I write the date on the calendar for when I've got to submit the next set of results in. And the same, unless I have a problem with how I feel, then I don't really touch it for those 4 weeks, if you know what I mean. So I try to get on with, you know, what I can do rather than sort of thinking, oh my God, you know, my breathing's not very good today. Or
that's interesting because Colin, I don't know what you feel about that. It did strike me that if you've got one of these bits of kit at home and you're feeling a bit off, you know, I'd be tempted to almost do it every day to make sure that I'm okay. But you don't do that now?
No, mine's every 2 months. I have to send mine. It's yes, I believe every 2 months. Second, third, fourth. Oh no, sorry, every month. And I think I did a couple. Yeah, I've got a couple that were just tests and not sent in, if you know what I mean, just to see what the results were for myself. But other than that, no, it comes up on my phone and it says spirometry test tomorrow. So the next day I send off my spirometry. Other than that, I don't pay a lot of attention. I do pay attention to it. Other than that, I'm not concerned with looking at it every day.
I'm very impressed with you. I'm very impressed with your spreadsheet. Can we have another look at that?
But you've got to keep the difference is you've got to keep a record of something.
So you don't just write it down in an old notebook then, like I would?
Oh, crikey, no. I keep spreadsheets for all sorts of stuff.
Wow.
Oh,
that's my hospital stuff. Because when somebody says to you, what happened then, you can tell.
Now, I think both of you have got your spirometers there, have you? Could you just show us what they look like? And right, it's incredibly simple, isn't it? So you put the tube, into there,
and then you just blow into it.
Really? Okay.
There's a little turbine there that and that must record everything with a little, must have a little chip in it that you can then link, it links to your phone.
Yeah.
I mean, it's incredible amount of little bit of kit.
It sounds as though you would both recommend this if somebody is considering doing it.
Oh,
yes.
I think the benefits of it outweigh the negatives of it.
Yeah.
Colin?
You know,
Yeah.
and if
Yes, most certainly. If it stops you going, I mean, it takes me an hour and whatever to get to the hospital. I've had to wait an hour and 40 minutes at one time from my appointment to realise after the time. So I put a morning away, whereas this takes me 10 minutes, and most definitely the benefits outweigh the pros outweigh the cons.
Excellent. That's
And the
very
cons
good.
only are that you don't have a guy standing there, you know, that you know is making you do it correctly. But after a while, you get to do it correctly yourself, hopefully.
it tells you on your phone if you haven't exhaled properly, doesn't it?
Oh yeah.
It comes up exhalation done properly, so it will tell you if it was a negative.
I can't thank you both enough for taking part in this, and I think your observations and experience will really help people who watch this video and are considering going onto home spirometry. So thank you so much for taking part, and it's been a pleasure meeting you.